everyone. Oh, I call this meeting to order at 10 a.m. My clock says 10 a.m. Are we ready? Ms. Preto, can you call the roll?
Yes, good morning. All right, Cervantes.
Here.
Kasuga.
Here.
Phillips.
Here.
Roll's complete.
Okay, thank you. So item number 2 on our agenda today is welcome and open remarks. The goal of this committee is to advocate for legislation and develop regulations that provide for the protection of consumer health and safety. The committee reviews, monitors, and recommends positions on legislation that affects the board, consumers, and the profession of psychology. The committee also recommends regulatory changes and informs the board about the status of regulatory packages. I just want to take a moment to thank everyone. This is our second and final committee meeting of the year. I'm really proud to have worked, to have been part of this work alongside you. Our work is situated on a continuum of ideas and countless hours of research that have happened over years in some cases. In particular, the legislative and regulatory work of the Board of Psychology has been incredibly busy in the last, I'd say the last 18 months, right before the COVID pandemic. And I just want to thank our team, our board members, committee members of this particular committee for their leadership, especially Ms. Sorick, who has really guided us through unprecedented times that brought tremendous loss. I just want to take a moment to acknowledge all that has happened before and how far we've come. We have a full agenda, but I'm hoping that we might be able to conclude our meeting before 2 p.m. today. So just by way of housekeeping and to create some predictability for all of us, I want to aim for a half-hour lunch break at noon. But I do want to come back to that and see where we are on our agenda, and then we'll make a decision at that point, or make an adjustment, I should say. All right. So with that, we'll go ahead and get started. Item number 3 on the agenda is public comment for actions not on the agenda. The committee may not discuss or take action on any matter raised during the public comment section, except to decide whether to place the matter on the agenda at a future meeting. Will the moderator has already posted the instructions for public comment. Thank you. Can we open the public comment?
Thank you, Madam Chair. I have opened up the question and answer panel, also referred to as the Q&A. And if any member of the public would like to make a comment, please type "I would like to make a comment" using the field in the lower right-hand corner of your screen and submit it to all panelists. We are displaying instructions for your reference, and we'll give you a moment.
I don't see any public comment.
This
Can we
is a
go?
Yep,
Go ahead.
I don't see any either. So shall I close the Q&A panel?
Yes, please.
Okay, it's closed.
Okay. Item number 4 on the agenda is the the waiver update. Ms. Sorick.
Thank you, Ms. Cervantes. Good morning, everyone. Included in the meeting packet is the waiver update and any kind of COVID waiver activities that the board has been involved in. The last waiver update that was attached to the meeting materials was from May 28th. However, there were two new waivers that were in fact extended. One was eligibility to take the exam, giving extra time for that, as well as extra time for getting continuing education. So those two waivers are the only updates that were made to the waiver list, and I'm available for any questions.
Thank you, Ms. Sorick. Is there any committee comments from the committee members? I'm sorry, I'm thinking faster than I'm talking. I see Dr. Phillips.
Thank you. Ms. Sorick, do we have any idea what the impact of the governor announcing he was extending the state of emergency through the end of the year is going to have on these waivers?
We do not. I was on a call the other day where it was discussed that the state would be reopening on June 15th. However, the declared emergency has not been lifted. So we, all the boards and bureaus are waiting word on how that may impact the waivers. We have been told that they are going to start a staggered system of expiring waivers at some point in the near future, but we haven't been given additional specific guidance. So as soon as our board hears anything, we will communicate that information to our stakeholders. However, I will just preface it in saying that we have requested for waivers, especially face-to-face supervision waiver, because our trainees and supervisors are still impacted by the pandemic, that if there's a way to extend those waivers as long as possible, if that could happen. So that request has been made by the board to the Department of Consumer Affairs. So that is the update on that. And as soon as the board hears word of any changes to the waiver system or how the declared emergency timeline is going to impact those waivers, we will communicate that to all of our stakeholders.
Thank you.
And hopefully in a timely manner.
Yeah. And much of that has been outside of our control up until now. The second question I wanted to ask you is the continuing education waiver. For the benefit of our licensees, they represent at the time that they renew their license, which comes up with whatever their anniversary date is, that they've completed their continuing education hours, except there's an additional extension of time within which to do continuing education, as I understand it. For the benefit of our licensees, what should they do in that situation?
I am going to defer to Mr. Glassbeagle, who runs the Central Services Unit that oversees the CE program. So, Mr. Glassbeagle, if you can speak to how we're handling that, that would be great.
Absolutely. Dr. Phillips, can you just specify, are you wondering how we're going to follow up after the fact and kind of reconcile the list of individuals that have stated on the renewal that they met the requirement but didn't meet it until afterwards?
Well, yeah, I mean,
internally.
I was fortunate enough, I'll just use myself as an example. I was fortunate enough to have completed my continuing education hours at the time of my renewal. But if we're giving this extension, I don't quite understand how we're asking licensees to represent they've completed their hours. And then perhaps they're completing their hours after their actual anniversary date, if you understand what I'm saying.
Absolutely. Happy to explain. So the way the system is working is we ask the licensees to still be honest and truthful on their renewal. And even if it says no, that they did not meet the continuing education requirements, there is a patch that DCA runs every night to find anyone within the specific expiration date period. And it overrides those alerts that we get, which that's the reason a renewal would not process if they said no. It's not necessarily the answer itself, but it's the flag that triggers in our system that would stop the renewal from going through. So
And how would our licensees know that?
They don't necessarily need to know that. They just know that they renew before their expiration date, and if they say no to the renewal or to the continuing education question because they don't have to complete it, then it will still process. And any licensees that have had that question have reached out, and I've provided it to a good number, I believe, or a few have asked, well, what do I do? And we tell them.
I wonder if we shouldn't be proactive in informing licensees of the situation so that they either don't misrepresent themselves or worry that they're not going to get their license renewed. In other words, we have the policy, but I'm not sure licensees are aware of the policy. So,
Ms. Chung, is there a way that we can, in Breeze, add in a box that somehow alerts people to waivers for CE and the renewal requirements? And I'm kind of thinking out loud a little bit here, but I'm wondering if, because this is kind of a moving target as far as when the waiver is expired. So I'm wondering if there's a generic way we can refer to, to ensure to check when, the waiver for continuing education expires and how that may impact your license renewal date or something. I don't know if there's like a general 2-sentence message we can put in the renewal form, or if that's even possible. Is that something, Ms. Chung?
Sorry, can you hear me?
yes.
Okay, perfect. So on the Breeze platform, I believe we can include some message on the screen where the licensee is going to renew. We could definitely include like probably a line or two there, kind of give a message what we would like them to know. We can definitely explore that. And if you have a verbiage or board members have a verbiage that you would like us to use, please feel free to share that with us, and then we can initiate a conversation with our Breeze team, and then to see how we can incorporate that.
I think that would be great. I also think even beyond that, we should be just telling licensees they don't need to be sweating their hours if they don't have them before the expiration date. So I'm thinking even of a broader message sent out to the licensees in one form or another, whether it's a blast email. I would say the newsletter, and I love the newsletter, but or the whatever we call it, the board journal. But I'm not sure exactly how many of our licensees it actually reaches. So, I mean, it's great that we have the waiver, but I'm not sure licensees are really aware we have it, and are therefore maybe taking extraordinary efforts also to finish their continuing education hours when they've actually been granted additional time within which to do it.
I think a message to all of our licensees by email is probably the best way to go as far as something that's timely and gets the message out. And maybe it's just something very general about, is your license up for renewal? Please ensure that, or something to the effect of your continuing education requirement may be impacted by current waivers. So you may check the no box if the waiver applies to your renewal period or something, and then we can attach the FAQs.
I think that'd be a great idea, something that would make it very clear to them what the situation was. Because I think it is one waiver that we need to be proactive on.
Okay.
Otherwise, it's kind of a waiver without an effect.
Right.
I don't know that it's been that much more difficult, honestly, to get continuing education hours during this period. I think people have just moved over, and Ms. Kasuga might have, or Dr. Kasuga might have a different experience than I. You just moved over more to, kind of, what do they call it? Synchronous? I forget what the term of art is, but I think
Live interactive.
Live interactive. I think that has probably been the mode that most people have moved to. But I think it's something that'd be good to get the message out. And I appreciate the suggestions in terms of both a license renewal form and perhaps a blast email.
I agree with Dr. Phillips about the need to make it more proactive, and I like Historic's idea of an email blast. Personally, I think whenever I see an email from the board, I usually read it right away. So I think that's the most effective way to reach licensees. As far as getting CEs, I don't think I have issues as well. I think that there's a lot of the live interactive types of CEs that I'm able to attend. So, but I think we have to, I'm acknowledging that I'm very well connected with the internet, and I live in a city that that's more savvy with technology. So, I can't speak for other practitioners in rural areas with regards how well they're getting information. So I think it's good to have, a way to reach them as many ways as we can to be proactive.
Thank you. That was a very good discussion. Do we have a plan moving forward then?
Yeah, I think staff has good enough direction from the discussion today to move forward with sending out a productive and helpful message to our licensees. And Mr. Glassbeagle and I will work together on that.
Excellent. Thank you so much. Thank you for the update and for staying on top of these changes, because it is important that we're prepared to, as a board, that the whole of us is prepared to anticipate the unique situation presented by the pandemic, and that we're able to help others, especially our licensees, navigate these challenging times. Thank you so much, everyone, for the discussion. Is there any other committee comment before I open up public comment? Okay, seeing none. Moderator, can we please open up the public comment?
Thank you, Madam Chair. I have opened up the question and answer panel. If any member of the public would like to comment on this agenda item, please type "I would like to make a comment" using the field in the lower right-hand corner of the screen and submit it to all panelists. We are displaying instructions.
I don't see anyone.
This is the moderator. I do not as well. So would you like me to close the Q&A panel?
Yes, please.
Okay, it's been closed.
Thank you. Moving on to the next item on our agenda, discussion and possible approval. It's item number 5. Discussion and possible approval of committee meeting minutes. It is found on page 17 of the combined packet. Committee members, is there any comment? I see Dr. Phillips.
Thank you very much. I have one minor comment. I'd given some comments before when we first received the draft of this, if my memory is holding out, and that's always a big question these days. But at line 185 of the minutes, I believe there should be a return between 2 paragraphs. So I don't know if the intention was to make one paragraph what Dr. Kasuga said and the other paragraph what Dr. Phillips stated, but given the formatting of these documents, I think there should be a return there. At the end of the word portentino,
Yep.
And before Dr. Phillips. So that was the only comment that I had.
Thank you. Dr. Kasuga? No comment?
No
Good?
comment for me. Thank you.
Okay, so if we could make a motion, do we need to include this, adding this format change into our motion? Or can that just happen?
If you just make a motion to approve the minutes with the amendment that Dr. Phillips mentioned, that would be sufficient.
Okay, thank you. So do I hear a motion to approve the minutes with the amendment proposed by Dr. Phillips?
So moved.
Thank you,
second.
Dr. Phillips. It's been moved and second to approve the minutes with Dr. Phillips' amendment. Ms. Petro.
Yes. Let's see. Cervantes.
Aye.
Kasuga.
Aye.
Phillips.
It's a real cliffhanger. Aye.
Thank you.
Okay. Motion passes. Thank you, Ms. Prateau. Moving on to the next item on the agenda, item number 6. This is our board-sponsored legislation for the 2021 legislative session, review and possible action. This point of the discussion starts on page 28 of the combined packet. Ms. Rivera, can you give us an update on item number 6A?
Good morning. Yes, absolutely. So as most of us are aware, the legislature decided to limit all legislators to 12 bills this year. As a result, our bill has become a 2-year bill. And so we are having to hit pause on this, and we will hopefully be able to resume in January and hopefully get it passed next year.
Thank you, Ms. Rivera. Are there any committee comments? Dr. Phillips?
Oh, I'm just a commenter this morning. Yeah, I'm wondering, since we've already made it through one body of the legislature, does it have to start all over again?
I will defer to Mr.
Rivera.
Glass-Steagall on that one.
Hi, Dr. Phillips. No, it will begin right where it left off.
Okay, great. Thank you.
I see no other committee comment. So I'll open up to public comment on this item.
Thank you, Madam Chair. The Q&A panel is now available. If any member of the public would like to comment, please type "I would like to make a comment" using the field in the lower right-hand corner of the screen and submit it to all panelists via our displaying instructions. This is the moderator.
Go ahead.
I don't see any requests for public comment. Would you like me to close the Q&A panel?
Yes, please.
All right, it's closed.
Okay, moving on to the next agenda item, 6B, Pathways to Licensure, Statutory Revisions and Amendments to Sections 27, 2909, 2909.5, 2910, 2911. They're listed in the agenda, but I'll just go through them really quick. 2913, 2914, 2915, 2915.5, 2915.7, 2942, 2944, 2946, and 2960 of the Business and Professions Code, Section 1010 of the Evidence Code. Ms. Rivera, could you please present item 6B? It begins on page 39 of the combined packet.
Yes, so in terms of where this is at, staff has been advised that the vehicle for these amendments will be SB 801, carried by Senator Roth. However, amendments specific to the Board of Psychology are pending. It currently only applies to the Board of Behavioral Sciences. So we are in a holding pattern and hoping that our amendments get taken. We don't know which amendments are going to be made. So we will see once things start moving with this one. This also applies to 6C.
Okay, thank you. Is there any committee comment? Can we open a public comment?
Thank you, Madam Chair. The Q&A panel is now available. If anyone would like to make a comment, please type "I would like to make a comment" using the field in the lower right-hand corner of the screen and submit it to all panelists. This is the moderator. I see no request for public comment. Would you like me to close the Q&A panel?
Yes, please.
Okay, it's closed.
Thank you. Now moving along to item 6C. This item is our sunset provisions. These are amendments to section 2912 of the Business and Professions Code and addition of sections related to the reinstatement to active after voluntary surrender, licensure committee delegated authority, and authority to issue waivers. Ms. Rivera, can you gave us a little bit of an update with 6B, but can you provide us a quick update on 6C? It's the item that begins on page 40 of the combined packet. And for today, I know it's only information, but we can just get a quick update.
Yes, sure. As I mentioned previously, we were told that this is going to occur in SB 801, which is carried by Senator Roth. We're awaiting amendments. I don't know if Ms. Sorik has anything she would like to add to this in addition to what I've said.
I do not. I think we were advised that the board would likely see some language towards the tail end of May, and we have not received that as of yet.
Thank you for that update. Is there any committee comments? I think on this item, it's important for staff to keep working with BMP staff. Our sunset provisions are obviously very important this year. So thank you for keeping track of this development, and hopefully with SB 801 develops, maybe we can talk about it at the next board meeting if the timeline comes together. I see no committee comment. Can we open up public comment?
Thank you, Madam Chair. I've opened up the Q&A panel. If any member of the public would like to make a comment, please type "I would like to make a comment" using the field in the lower right-hand corner of your screen and submit it to all panelists. This is the moderator. I see no request for public comment. Madam Chair, would you like me to close the Q&A panel?
Yes, please.
Okay, it's closed.
Okay, we are moving along to item 7, legislative update, review, and consideration of additional changes. And item 7A is bills that the board has taken active positions on. The first one is AB 32. Ms. Rivera, could you please present item 7A1? It begins on page 41 of the combined packet.
Yes, one moment. So let's see, this bill would require the State Department of Healthcare Services to indefinitely continue the telehealth flexibilities put in place during the COVID-19 pandemic state of emergency. The bill would require the department by January 2022 to convene an advisory group with specified membership to provide input to the department on the development of a revised Medi-Cal telehealth policy that promotes specified principles. The bill would require the department by December 2024 to complete an evaluation to assess the benefits of telehealth and Medi-Cal, including an analysis of improved access for patients, changes in health quality outcomes and utilization, and best practices for the right mix of in-person visits and telehealth. The bill would require the department to report its findings and recommendations from the evaluation to the appropriate policy and fiscal committees of the legislature no later than July 1st, 2025. The bill was sent over to the Senate, and it is currently in Health Committee waiting for hearing.
Thank you, Ms. Rivera. Is there any committee comment? Okay, I see none. Can we open up public comment?
Yes, this is the moderator, and I have opened up the Q&A panel. If any member of the public would like to comment, please type, "I would like to make a comment," using the field in the lower right-hand corner of your screen, and submit it to all panelists. This is the moderator. I see no requests for comment at this time. Shall I close the Q&A panel?
Yes, please.
Okay, it's been closed.
So the next item, 7A2, is AB 107, Department of Consumer Affairs Board's temporary licenses for military spouses. Ms. Rivera, could you please present item 7A2 beginning on page 57 of the combined packet?
Yes. This bill would expand the requirement in Business and Professions Code section 115.6, which relates to issuing temporary licenses for individuals married to or in a domestic partnership or other legal union with an active duty member of the Armed Forces of the United States who is assigned to a duty station in this state under official active duty military orders, to include, among others, the Board of Psychology. The bill would require a board to issue a temporary license within 30 days of receiving the required documentation. The bill would require a board to submit to the department for approval draft regulations necessary to administer these provisions by June 15, 2022. The bill would exempt from these provisions a board that has a process in place by which an out-of-state licensed applicant in good standing who is married to or in a domestic partnership or other legal union with an active duty member of the Armed Forces of the United States is able to receive expedited temporary authorization to practice while meeting state specific requirements for a period of at least 1 year. Under BPC 2946, the Board of Psychology allows a psychologist certified or licensed in another state or province and who has submitted an application to the board for a license in this state to perform activities and services of a psychological nature without a valid license for a period not to exceed 180 calendar days from the time of submitting his or her application or from the commencement of residency in this state, whichever occurs first. Staff spoke with the author's office and sponsor, who advised they are willing to assist the board in making the necessary modifications to BPC 2946 to include the board under the exemption above. The author's office advised they would be pursuing our amendment when the bill is in the Senate Business Professions and Economic Development Committee. Amendments to BPC 2946 can be found at the end of the analysis. This bill has been referred to the Senate Business Professions and Economic Development Committee, and we are awaiting hearing.
Thank you, Ms. Rivera. Is there any committee comment? comments from committee members? Sorry. Okay, seeing none, could we open up public comment?
Thank you, Madam Chair. The Q&A panel has been opened. If any member of the public would like to make a comment, please type "I would like to make a comment" using the field in the lower right-hand corner of your screen and submit it to all panelists. This is the moderator. I see no requests for public comment. Madam Chair, would you like me to close the Q&A panel?
Yes, please.
Okay, it's closed.
Thank you. The next item, 7A3, Durazo Criminal Records Relief. Ms. Rivera, could you send an update on item 7A3 that begins on page 74 of our combined packet?
Yes. Among other things, this bill amends section 11105 of the Penal Code, which would prohibit the board from receiving conviction information for applicants to the board if their conviction was granted relief pursuant to sections 1203.4, 1203.4A, 1203.41, 1203.42, or 1203.49 of the Penal Code, so long as a period of 2 years has elapsed since the date the relief was granted and the applicant was not convicted of a new criminal offense. This bill would have a large impact on the Board of Psychology's licensing and enforcement programs, and it would hinder the board's ability to carry out its legislative mandate of consumer protection. Currently, the board completes an enforcement review for every applicant with a criminal history, determines whether the crimes committed are substantially related to the duties of licensure. This bill would significantly diminish the board's ability to make these determinations without access to the necessary conviction information. On May 20th of this year, amendments were accepted in the Appropriations Committee. These amendments exclude serious, violent, and sex felonies from automatic relief, delay automatic relief for 4 years where there is a supervision violation or a new felony conviction, strike the restriction on the access to cleared records, and limit retroactivity to January 1st, 2005. The bill is currently sitting in the Assembly and it is held at the desk.
Thank you, Ms. Rivera. Is there any committee comment? Comments from committee members, sorry. Dr. Phillips. Dr. Phillips?
Sorry, I thought I had my mic on. Ms. Rivera, does the fact it's held at desk have any significance?
From what I understand, it can be taken up at any point, but it is currently sitting at the desk. So I don't know if Mr. Glass-Steagall has any further clarification or information he can provide on what that means specifically.
Hi, Dr. Phillips. We're not sure if it's being held because they're waiting to refer it somewhere or if they're holding it because it was not going to continue due to the reduction in bill load. So we're just waiting to see what happens.
Okay, thank you.
Any other comments from committee members? Seeing none, could we open public comment?
Thank you, Madam Chair. I am opening up the Q&A panel, and if any member of the public would like to make a comment, please type "I would like to make a comment" using the field in the lower right-hand corner of the screen and submit it to all panelists. We are displaying instructions.
Ms. Cervantes, this is Jason. Can I make a quick update on this bill? I'm just checking its status right now. And last night it was referred to the Committee on Public Safety.
The Committee on Public Safety and Assembly?
In the Assembly, yes.
This is the moderator. I'm seeing no requests for public comment. Madam Chair, would you like me to close the Q&A panel?
Yes, please.
Okay, it's closed.
Okay, so we just got an update from staff about SB 731. I just want to open up if there's any committee comments from committee members with regards to the update.
None from me, thank you.
Okay, I see none. Let's go ahead and move to the next item, which is 7A4, SB 772, Professions and Vocations, Citations and Minor Violations. Ms. Rivera, could you present this item? It begins on page 94 of the combined packet.
Yes, of course. This bill would prohibit the assessment of an administrative fine for a minor violation and would specify that a violation should be considered minor if it meets specified conditions, including that the violation did not pose a serious health or safety threat and there is no evidence that the violation was willful. Staff has learned that this bill is a 2-year bill, so it is not going to move this year.
Okay, thank you for this update. We haven't reviewed the specific positions that the board took as we've gone through the updates, but on this one it was opposed unless amended. It's all in the board packet, but I just wanted to acknowledge that for anyone following, any members of the public following along. Is there any comment from committee members on this item, 784? Seeing none, could we open public comment?
Thank you, Madam Chair. I will open up the Q&A panel. And if any member of the public would like to make a comment, please type "I would like to make a comment" using the field in the lower right-hand corner of the screen and submit it to all panelists. We are displaying instructions. This is the moderator. I see no request for public comment. Would you like me to close the Q&A panel?
Yes, please.
Okay, it's closed.
Thank you. So our next item is 7B, and we have a list of watch bills that we determined from our last meeting and our board meeting in May. Some of these bills are no longer active. Ms. Rivera, could you tell us which bills of these listed are still active?
Yes, of course. So in terms of bills that are active and moving through the process, we've got AB 225, AB 339, AB 562, AB 657, AB 830, and SB 221 and SB 224.
Okay, thank you. Committee members, are there any bills you would like to discuss? Dr. Phillips?
I just want to clarify to make sure that I've heard this correctly. So, Ms. Rivera, AB 29 and AB 885 are not moving forward?
That is correct.
So, but AB 562 is moving forward.
Yes.
Okay, I'd like to talk about AB 562 if we could.
Okay.
That bill was referred to the committees on business professions and economic development and judiciary.
There was some, I wanted to ask, if Dr. Kasuga, before we provide the update, because there was also some, the status of this bill is active, but it's also the language changed. So before we get into that, I just want to hear from Dr. Kasuga if she has any bills that she'd like to discuss. That way we could just run through those.
Thank you. I just wanted to discuss SB 221. Thank you.
SB 221. And while it's not active, AB 1236, item number 12 on the list, I'd like to discuss that so that our record can have some closure on that discussion, since we spent some time talking about it here and at the board meeting that followed. So for this list of watch items, we're going to discuss item number 5, AB 562. Item number 12 is AB 1236. Brief update, it's a bill that we already acknowledged is not active anymore. And item number 15, SB 221 from Wiener. Did I get that right?
I believe so.
Okay, thank you. I just want to focus our discussion for this. So can we start with AB 562? And Ms. Rivera, you briefly mentioned the update of its status, but can you tell us a little bit about, well, you maybe review the update that you have on that item, because the language is different than it was before.
Absolutely. So on April 8th, this bill was amended to, among other things, define board as the Board of Registered Nursing, the Medical Board of California, the Osteopathic Medical Board of California, the Physician Assistant Board, and the Respiratory Care Board. It defines eligible licensee as a person licensed as a healing arts provider who is or was also a frontline healthcare COVID-19 provider. And it defines frontline COVID-19 healthcare provider as a person who provides or has provided consistent in-person healthcare services to patients with COVID-19. Prior to this amendment, it was more open-ended, but this narrows the scope of who they are considering as COVID frontline providers.
Isn't there another update too about now a new focus with DCA instead of specifically with the Board of Psychology?
Let me check real quick. Hold on. I know we had asked, I reached out to staff to see if, the Board of Psychology was someone that or a group that they wanted to include in the list, and I did not hear back. So I think they're pretty set on including these groups, these boards in the discussion of who this pertains to. One moment. Let's see. So it does say that it requires the DCA and relevant boards to report to the relevant policy committees of the legislature the following information regarding the mental health program. The description of contracted vendors.
Okay, I understand. I understand. I got my wires crossed.
Okay, no worries.
Dr. Phillips?
I'm just wondering if we can follow up with legislative staff to see if, I know we didn't get a response and we're taking that as a response, but see if we could actually get a response.
Absolutely.
Thank you.
Thank you. Any other comment on AB 562? Committee comments? Okay. Ms. Rivera, can we get an update on AB 1236?
Yes, so 1236. Hold on, let me get to the right page here. Assemblymember Ting has moved it to the inactive file. DCA has been working with OSHPD directly to see if they can figure out a way for OSHPD to be the ones to collect the data and not put the onus on the boards to collect and report the data. So in that instance, Assemblymember Ting decided to go ahead and pull the bill and put it on the inactive file. Ms. Sorek, do you have anything to add to that?
I do not.
Thank you. I just wanted to have closure to that conversation reflected in our discussion today. And then the next item is SB 221. So it's number 15, Wiener Healthcare Coverage.
Yes, one moment. This bill codifies existing timely access to care standards for health plans and health insurers, applies these requirements to Medi-Cal managed care plans, and adds a standard for non-urgent follow-up appointments for non-physician mental health care or substance use disorders within 10 days of the prior appointment. This bill has been referred to the Health Committee, and we are awaiting the hearing date.
Dr. Kasuga, do you have any additional comment on that one?
Yes, I'm wondering if the board staff has made any analysis or review of the bill for recommendations.
We have not, but we definitely can.
Yeah, I just think that like since our mandate is to protect consumers of psychological services, I think it's a bill that um, I'm looking at possibly supporting because um, it's part of consumer protection. It's a consumer protection bill that um, supports timely access to mental health services for enrollees of just healthcare, service plans that the recipients of which are our consumers. So I think that it's something that we can look into supporting if it doesn't have any negative impact on our board, which I don't think there is.
Okay, I will definitely work on that.
So, what you're asking for, Dr. Kasuga, is a deeper analysis so that we can determine if this is something that we want to support. Might we, I don't know, maybe staff can help me just anticipate what that can look like in the coming months. If that is that something that we would do at that we would present a more thorough analysis for consideration by the board at our next board meeting?
So our next board meeting is going to be August 27th, and just looking at the legislative calendar, the last day for fiscal committees to meet and report bills to the floor is August 27th, and then they have floor session, and then they go into let's see, last day for each house to pass bills is September 10th. So we would still have time to advocate.
So, so Dr. Kasuga, is that satisfactory to take a position at that time when we have more information?
Yeah, that's fine with me. I wonder if like other committee members have any opinion about that as well.
I don't necessarily have another opinion. I'm assuming that this proposed statute is a reaction to the prior bill that allowed for same-day service, which I think went down for the count. So it'd be interesting to get some more information on it, I think, and see if the board wants to take a position, which I guess means it would kind of get. I don't know how you order the material for purposes of the board meeting, but it would get pulled up higher in the ranking in order for board members to be able to discuss it if they wish to.
Mm-hmm. I think this is one of these areas where, for me personally, not being a practitioner, I'd like to review more carefully. Just I would just like to understand it better. That's what I'm thinking right now. Is this so we'll move forward with request for a deeper analysis by staff and an update that we might provide for the board for consideration at our August meeting. Is that, do we need a motion for that, or
This is Jason. I don't think so, but I'll defer to Mr. McGuire.
Yeah, I was thinking no as well, since you're not voting on an actual position. This is more of a direction to staff to do the analysis and then bring it back to the board for our August 27th meeting, at which time we could tee up a vote on a position for that meeting. So we can just mention at the board meeting that we discussed it at this committee meeting, but we didn't have the analysis done. Here's the analysis now for you to make your position known.
Is that satisfactory, Dr. Kasuga?
Yes, yes, thank you so much.
Okay, thank you everyone for that process. Is there any other committee comments on any of these items on 7B, these watch bills? Okay. Wait, oh, I'm thinking about public comment. So we discussed these three bills. Now we can open up for public comment before we move on to item 7C. Thank you.
All right, this is the moderator, and I will open up the Q&A panel. If any member of the public would like to make a comment, please type "I would like to make a comment" using the field in the lower right-hand corner of your screen and submit it to all panelists. We are displaying instructions. This is a moderator, and I see no request for public comment. Madam Chair, would you like me to close the Q&A panel?
Yes, please. Okay,
it's been closed.
Okay, thank you. Now moving on to the next item, item 7C, is an update, consideration, and possible action on Governor's budget trailer bill proposal on Bagley-Keene Open Meeting Act, remote participation in meetings. Mr. McGuire, do you have an update on this item?
I do, and thanks for the opportunity to present to the committee. I took the unusual step of suggesting an agenda item for this committee to consider, and that was this one. The reason I did that was a twofold, but one was at the previous board meeting, the board asked me to look at AB 885, which was making some changes to Bagley-Keene, or proposing to. And at that meeting, we ultimately directed staff to work with the author's office to make some clarifications and some suggested amendments to kind of clean up those Bagley-Keene amendments. In the interim, we noticed that bill is not moving this year, 885. It's becoming a 2-year bill, so we'll keep our eye on it next year. But we anticipate in general that some sort of Bagley-Keene reform is going to come to, and by Bagley-Keene I mean the Open Meeting Act, which governs kind of how we conduct our meetings, the nuts and bolts of that. And so we anticipate there'll be something coming down the pike, and so we wanted the committee to have a chance to weigh in and be updated. And at the time we put this agenda together, it looked fairly likely that the governor's budget trailer bill might be that vehicle that would be used. It's part of the May revise, and he puts together, his office through the Department of Finance puts out various proposals, including this one that's attached starting, let's see, okay, it's up here. You're looking on the screen, you're seeing actually the Assembly's comments on the bill if you scroll down a little bit. I'm not controlling the screen because I've got some other notes, but actually on, give you a better page site here. If you can scroll down to page 195, moderator, that's the proposal on Bagley-Keene, and what they're doing or propose to do is to codify essentially the executive order that we've all been working under for the past year plus, which allows us to meet like this remotely. It makes some other changes as well, including, previously you'll probably recall before the pandemic, if you were going to participate remotely at a meeting, you needed to be at a place where also the members of the public could attend. And so this bill would get rid of that requirement. So it would essentially allow you to continue participating from your home or office or elsewhere, rather than everyone traveling to Sacramento or elsewhere for all of our meetings. And given that this board has a lot of not only meetings but committee meetings as well, that's fairly significant. I know there's quite a bit of budget savings involved with that. So this is all kind of a lot to say. I wanted to provide an update on what's going on with the process, and then let the committee members and members of the public discuss what they think, what reforms they think might be useful, kind of looking forward, because where we are right now, as far as the update goes, is actually the Assembly rejected this particular proposal. So it's not moving forward in the Assembly, at least for now, and the Senate Committee on Budget decided not to take it up as of now. And the budget has to be passed by Tuesday, June 15th. So it still, from what I can tell, negotiations are still ongoing. I've kind of done some back channel research to kind of hear what people are saying, and it sounds like they're still talking. The governor's office and the legislature, Department of Finance does want to try to push this through via the budget, but many members of the Senate and Assembly still believe it should go through the typical policy committee, because it's a big change that affects lots of every public, state agency. And so it's more likely, I'd say, that it gets done that way, although it still could get negotiated into the budget. But essentially, so that's kind of the update on what's happening. That we don't know. We might know more on Tuesday, and probably in the coming weeks, presuming it doesn't make it into the budget, we'll later find out what bill it's moving under. But yeah, that's kind of what's happening. And I wanted to open up this space just for any questions or comments from committee members as to, in particular, what they think might be a useful term to have in any Bagley-Keene reform. And staff and myself can use that information and that discussion to kind of inform our ongoing discussions that we have in our daily lives behind the scenes to do what we can to make any changes. So I'm not recommending any official position or vote by the committee today. Of course, that I wrote the item broadly enough that if there was a motion or something, we could do that to endorse some particular course of action on this. But I don't think it's necessary at this time. Some topics to consider in particular are whether we want to allow or not allow remote teleconferencing for all meetings. Currently, that's what's in the most proposals. Whether or not we want to permit or require video or audio or both. I think right now it's both, but some proposals, including 885, were requiring video in all cases. Whether in-person attendance is required by all board members or not. And then one thing that's a little bit different flavor is when we have a petition, oftentimes the petitioner will appear before the board, and that gives the board members a chance to kind of gauge the credibility of that witness and see kind of their demeanor, and potentially that chance is diminished when you're participating remotely. So just topics to consider and get the discussion going, and again, happy to answer further questions or just leave it as this update.
Thank you, Mr. McGuire. Is there any comments from members of the committee? I just have one issue that I didn't see explicitly addressed, and I don't know how this might be addressed legislatively, Mr. McGuire, but this, an observation. Our practice here at the Board of Psychology has been very consistent since we started meeting remotely. Our agendas have a link where members of the public can join, come and be a watch our proceedings. That has not been the practice of all governments in this period. They have different things, like you have to log on to a certain site or different types of things. And I think that consistency and predictability is important. You know, I don't know how I don't know if if that could become another sticky point for the people who are negotiating this policy, but just a consideration of the way that people access the meeting should be consistent. And I think our model is a particularly good one. That's just my 2 cents.
Yeah, if I understand your comment, I think you're saying, you know, we're a good example of how we standardize the public's access, at least during this time, during the pandemic, and whereas you've observed that other boards or agencies are not necessarily doing that. One of the pillars of the governor's proposal is that it would require a teleconference option in any case, so that the members of the public can always participate remotely and they don't have to travel to Sacramento. So for now, it's sort of under the executive order, it's basically an option, but almost everyone that I'm aware of is taking advantage of that option and not meeting remotely because of health concerns. But once those health concerns are gone, the lesson learned from all this is that remote meeting access increases participation. And a secondary benefit or an ancillary benefit is that it reduces costs. So, I mean, one area to consider is just kind of what I alluded to with the in-person is there something to be said for continuing to require public in-person attendance, at least for part of a quorum of the board members or something like that. Certainly that's something to consider. But I hear what you're saying, and so far that's kind of in the proposal. I think most of the proposals that are out there incorporate some aspect of what you're talking about, but certainly, that's, yes, so that's something we'll, to some extent they do ask me behind the scenes now and then, like, what are boards saying? What do they want to see? So I'll be able to kind of relay that information.
Yeah. I just think we've had a really good practice at that, and just my own experience in the last year and a half from local governments representing me here. I just see so many different things that if I didn't know how to navigate these public meetings, I might not be able to access some of my local school board meetings.
Yeah, example. And an important point on that is that local governments are under the Brown Act versus the Bagley-Keene Act, which is a different piece of legislation, which I don't know, as I sit here today, what they're doing as far as the Brown Act, since it's not kind of our jurisdiction, but I'm guessing they're doing something similar.
That's right. I forgot about that distinction. I wonder if that's part of the holdup to bring some kind of togetherness to these ideas, which I think are maybe overdue, but it's a good discussion to have, and I do think we have a good model. Dr. Phillips?
Yeah, I just wanted to comment. I do think one thing that's been particularly encouraging about this period, not that the pandemic itself is encouraging, but is that this has allowed more access to and participation in board committee meetings and board meetings themselves. So I think that has been a net positive. I do have a concern, however, about having some kind of hybrid meeting where some people are there in person and some people are there. Some of the board members or committee members are there by way of remote access. Only because I think there's a certain synergy that occurs when a deliberative body comes together in person, or more particularly, I think a lot of us are feeling the loss of contact with our colleagues on the board. I have not met a few of our colleagues on the board, and in person. And it's very hard to build the kind of personal relationships, I think, that allow, as I say, a positive synergy among board members. So that part of it gives me some hesitation, but I certainly think anything that gives greater access to the public for purposes of getting their input and to keeping them informed as to what we're doing as a body would be very valuable. But I'd hate to come up for a board meeting and have 4 of us there and five of us phoning in remotely. I think it's going to be a very stilted process. But that's just my first impression without having actually gone through it.
And
Yeah.
if I can just from a staff perspective, just kind of chime in that I think if the Bagley-Keene Act gave us the ability to kind of do, one way or the other, we would not opt for a hybrid model. I think if we were going to do an in-person meeting, we would do an in-person meeting, or if we were going to do a meeting such as today by, a web-based platform, that we would do that. So it would be kind of a staff choice working with the board president to, go one way or the other. We just want to know that we have the ability or authority through the law to go one way or the other, and what that looks like, either audio or whatever the components of those requirements would be. If we have one physical location posted, and then board members could participate remotely either by audio or through a web-based platform, but we want to make sure that if, let's say, for example, the concern is that the physical addresses of the board members where they're calling in from, such as their home, are not posted, that would be something we would want to provide as feedback to the governor's office on the details of the requirement.
I know there might be cost savings in terms of reducing the number of meetings that require in-person attendance. And today would be a very good example of a meeting maybe necessarily we wouldn't need it to come to Sacramento to have this discussion, given that relative to our typical agenda for the Ledge Reg Committee, it's a little easier to get through and a little lighter. So I can definitely see the advantages of that, especially from an economic point of view, let alone the wear and tear of travel. But I'm also wondering what additional technological needs we're going to have as a result of this. I'm sure that would probably be addressed at the level of the Department of Consumer Affairs, but that might have an impact on our pro rata. So it just all feels so vague, and there's so many conflicting propositions as far. It's a little hard to keep track of exactly what's going to come out of this, and I guess that's part of the process of negotiation. And we may not have much opportunity to comment on it, but I think there's a lot of moving pieces.
Definitely.
Yeah, and I think that, for instance, if we were to go to a model where we're going to do remote participation by committee members and board members, or if that be an option available to us, as long as there was an alternative way for the public to be involved in the meeting, it'd be more convenient probably for some of our members to be able to operate from their homes as opposed to going to some state location somewhere in the city for purposes of the meeting. So I find it all a bit confusing, honestly, and I'm not exactly sure what's going to emerge out of this.
Yeah, well, it is confusing, and sorry if I've made it more confusing. I hope I tried to lay out the process and just kind of open an open forum to discuss it. But since you're right, it's a moving target with a lot of moving pieces, and we don't know exactly when and where we're going to have an opportunity to weigh in. So I'm just trying to hear your various concerns and thoughts so that myself and staff in the interim, if things happen quickly, we'll just at least sort of know generally what the thinking of some of our committee members are without it necessarily being an official position of the Board of Psychology. Because if you think about, we're one fish in a giant sea of agencies that this affects. So we could be the squeaky fish that gets the grease if we really want to, but also just in general, it would be good to kind of take the temperature of this committee.
Did you say squeaky fish?
Yep, to mix a metaphor or two, yeah.
But I do actually think, Mr. McGuire, your discussion was helpful.
Yeah.
There's only so much specificity you can give us in light of the circumstance. But it did
There's
set
one, yeah. There's one particular provision that I think even Mr. Glass-Steagall noted when we were prepping for this meeting that is fairly absurd in its ability to actually be implemented. And if I can find it here for you, I'll let you just take a look. It's one provision that I don't find to be very useful. And just a moment as I find it. But it relates to us being required to essentially monitor the number of attendees of members of the public basically at all times, and if it ever drops below 50% of what denominator, I'm not sure, then we have to basically stop the meeting and reconvene it later. So I'm just looking for that provision right now, but that one doesn't seem very workable. And that would be something. Go ahead.
Yeah.
I'm just looking for it now. Maybe Jason has it more readily on the materials than I.
I don't.
I think
Okay,
that's
hold
almost
on.
impossible for any.
Yeah. Oh, I found it here.
At the state level.
Yeah, if you look at the bottom of page 196 of your materials, if a state body discovers that a means of remote access required by these provisions has failed for the majority of the participants during the meeting, the state body would be required to end or adjourn the meeting and take specified action. So I get the idea that they're saying they're wanting to safeguard for, technical issues, but it's like a majority out of whom? Out of the ones who were there at any given point? What if somebody dropped off on purpose because their issue was completed and they didn't, how are we supposed to know that or account for that? So that doesn't seem workable. So I would suggest that you guys just voice your opinion on that. So I take that back and say that particular provision, while well intentioned, doesn't make a lot of sense to me.
I'm not even sure how we would know
Exactly.
technical difficulties, because people could be just bored with our discussion and decide to get
exactly.
So that seems very unworkable to me. I also think, Mr. McGuire, while I'm thinking of it, when they start dictating that you have to have both audio and video, but without the specificity as to what they're actually requiring, if all board members need to be on the screen at the time, but we are also using screen sharing for purposes of looking at agenda items or draft language or anything of that nature, it makes it highly restrictive in a way that would perhaps take away from the clarity of the meeting. So I think when overly specific about audio and visual for the entirety of the meeting, I think that's also problematic.
Yeah.
Yeah, I agree.
Because then it would also require that, well, by extension, the state then would need to be responsible that every single member has a device that can do that. I don't know that I don't know that every single committee of the state, some only form for like ad hoc, or they finish the project they're dealing with and then those committees go away, but the idea of providing a device for every single one, I seem.
Yeah. I would say for its part, the budget trailer bill language proposal from the governor this time around does not require video for all components. It requires a teleconference line for the public, and then that audio or video or both. So that gives us still, and that's just preserving the status quo. I think we looked at AB 885 last time in the board meeting, and that was the one requiring video. But that's not to say that that proposal may not come back. So it's helpful for us to have this discussion so that if anyone asks me or Antoinette or Jason if they think it's a good idea that we have video, we can say, no, I don't really think so. That's not workable.
You know, see, this is one of those things where I think we have a good model in the way that we use WebEx. And I guess I don't, as different situations might come up, I guess I'm just trying to provide kind of that foundation, because the way that the layout is for WebEx, you can have the little squares for the participants, and you can see, like if you're sharing a document or a presentation right now, we're looking at our agenda, but there may be other software that might be, I don't know what the costs are for these different softwares, that doesn't do that, that doesn't list the participants, that doesn't list those types of things, and that creates inconsistency. And then that also might, I don't know if everybody in the state government uses WebEx the way that we do, but I can see where some smaller groups might not have access to technology the way that we do, and the IT professionals that we have access to at DCA. Which is probably why we have a good model.
Well, beyond just the software, there's also connectivity issues that come from, you know, whatever Wi-Fi access people may have. And when you add video, that connectivity issues tend to increase, and then there's like freezing of people, and you know, I mean, it's the same with telehealth. There's a lot of issues that come with you know, connectivity when there's audio and video.
I mean, I would imagine that for some boards, commissions, at the state level, there are participants who are in these rural areas. And so and they're probably smaller, and they probably, you know, my whole point is, Mr. McGuire, we have a good model. Let's preserve our model.
Yeah. Well,
and support that other people adopt something similar so that we can have consistency and everyone accesses. So like a similar layout where we can see who's on or not on, you know, just, we have a good model. I don't want to belabor this point. Is there any other comments on this Bagley Keene update?
Just that I think we've heard unofficially that the governor's executive order, I think Antoinette alluded to it, is plans to continue beyond June 15th. We don't know quite how long on that, but we can continue meeting in this way, at least, you know, for the foreseeable future, unless there's some change to the law.
Okay, thank you. So you got some feedback from us.
Yeah, and any members of the public who are interested in speaking on this too, or any staff members who didn't have a chance to speak yet.
Well, let me open up public comment real quick.
Thank you, Madam Chair. Let me go ahead and open the Q&A panel. And if any member of the public would like to comment on this agenda item, please type, I would like to make a comment using the field in the lower right-hand corner of your screen. We are displaying instructions. And we do have a Joe Linder Crow who would like to make a comment. So Joe, I will let you know when you've been unmuted. All right, Joe, you've been unmuted.
Hi, good morning, everyone. Dr.
Hi.
Joe Linder Crow with the California Psychological Association. I will just make one quick observation. We've all certainly had to deal with adjusting to a virtual environment. I do think we've talked about this, so among some of us who attend these meetings and the board meetings, I do think that there has been a little bit lost with regard to public comment. We're certainly allowed to make public comment, but often it's very limited, and there's not an obvious way for sort of a back and forth and to ask questions and answer questions, which we sometimes, excuse me, would have in an in-person environment. The other thing, and I don't know whether this is a function of WebEx, it's not a program, it's not a platform that we use at CPA, but we are not able to see who the participants are. We can see who the board members are and the staff, and I can see that I'm here, but I don't have any way of knowing who the other people are who are members of the public who are attending the meeting. So I'll just offer that, you know, and with no video component, we can't see the board members, and therefore, you know, we just have the audio, which is not, it would be more complete perhaps if we had the audio and the video component, which is, I think, what a lot of us have become more used to. So just a few comments to consider when you're thinking about what the model is that you might want to use going forward. Thank you very much.
All right, this is a moderator, and I see no further requests for public comment. Madam Chair, would you like me to close the Q&A panel?
Yes, please.
Okay, it's closed.
Okay, thank you for the public comment. Seeing no other public comment, we'll move on from item 7C and we'll move into item 8. I did want to just kind of do a quick temperature check. We're almost at the finish line, so maybe we won't need to break for lunch. Is it okay with everyone if we just move through and forget about taking a lunch break?
Good with me.
Okay, thank you, Dr. Phillips. Are you
I'm
good,
good
Doctor?
too.
Okay. Okay, cool. So let's move right along to item number 8 is legislative items for future meeting. This is our time. The committee may discuss other items of legislation in sufficient detail to determine whether such items should be on future committee or board meeting agendas, and or whether to hold a special meeting of the committee or board to discuss such items pursuant to Government Code Section 11125.4. Are there any committee comments? Any comments from committee members?
Not for me.
None from me too. Thank you.
Okay, I don't have any items on this either, so we'll move along. Oh, I'm sorry. Is there a public comment?
Thank you, Madam Chair. I have opened the Q&A panel. If any member of the public would like to comment on this agenda item, please type. I would like to make a comment using the field in the lower right-hand corner of your screen and submit it to all panelists. We are displaying instructions. This is a moderator, and I see no request for public comment at this time. Would you like me to close the Q&A panel?
Yes, please.
Okay, it's been closed.
Okay, and we'll move on to item number 9. This is the regulatory update review and consideration of additional changes. This begins on page 198 of the combined package. Mr. Glass-Steagall?
Thank you very much. As an update on the board's regulatory packages, the standards of practice of telehealth was delivered to the Office of Administrative Law about a week or so ago. We are working on the final statement of reasons for the continuing professional development regulatory package. And we are creating we've have a first draft of the initial statement of reasons and are working on the notice for the fee change regulations. Everything else is in the DCA process, and I'm happy to answer any questions.
Is there any questions or comments from members of the committee? Dr. Phillips?
Yes, I noticed for items B and C, and that would be the reg packet on psychological assistance and the reg packet on retired licensees, et cetera. Those have both been with the department since November of last year. I'm just wondering if we have any sense of when that'll be getting through the initial departmental review, because obviously the longer that takes, the longer the process takes.
Great question, thank you. The retired license package is actually with me. Yesterday I completed some updates to the forms, and I will be adding, I have to add the disclosure sections. I had to add the end of the forms, have to have the special mandatory language saying that your information can be disclosed and stuff like that. So now that I've put all of those into the back of the form, now I have to go through the initial statement of reasons and notice and put the justification, the legal justification for those, which Heather Hoganson, our regs attorney, so graciously provided me. So once I have to reconcile the two documents, put it in, and then send it back. And that's all I'm waiting on before this thing is should be ready to start going all the way through the department. As for the psychological assistant package, I did follow up on that recently just to check on the status. I've recently re-provided all the documents to DCA to keep that package moving. Did that answer your question? I'm sorry.
Yeah, I understand that the one package has come back to you for some minor changes, but the psychological assistance package has been languishing in review for 7 months.
There was definitely an issue around the transition of legal counsels, and that package I do think got jumbled kind of in that process, and we have since attempted to bring that back full circle and get the review right back on schedule.
I appreciate the update.
Any other comments from committee members?
Not from me. I appreciate the update as well. Thank you.
Thank you, Drs. Phillip and Kasuga. Can we open up public comment?
Thank you, Madam Chair. I will open up the Q&A, and if any member of the public would like to make a comment, please type "I would like to make a comment" using the field in the lower right-hand corner of your screen and submit it to all panelists. And I have Dr. Joe Linder-Crow who would like to make a comment. So Dr. Linder-Crow, you have been unmuted.
Thank you. Hi again. Just a question, really. I know we're all anxious to know what's happening with the continuing professional development package. And Jason, I heard what you said. Maybe you could just give us an update on what will happen. So the implementation date we know is January of 2022, and now it's June. What will happen if this takes the rest of this year? What's the process for changing that implementation date? Because it obviously, I mean, it wouldn't be possible to implement in January.
Thank you for your question. I'm actually going to request that Ms. Hoganson weigh in. and advise on how we would update that more towards the end of the process.
Hello, this is Heather Hoganson from Legal, and I'm sorry the static got in part of that question. So which one?
So if the continuing professional development package is not implemented or is not able to be approved by the Office of Administrative Law before our language states the effective date of the package, right? The implementation of the regulations. How is there a process for requesting OAL update those references to that specific date or?
Right. Sorry. Yes, once we finished reviewing the comments and packaging that and getting the department approval, and it goes to agency and gets the agency approval, we'll submit it to OAL, and at that point we can work with the OAL attorney if they think that the deadline is too close. So that would be something that would happen with the OAL attorney after submission. But they've been gracious enough to make those sort of changes before, based on timelines. Does that answer your question?
It's I don't know if my mic is still live or not. Yes, I guess the question is how much lead time we would all have. I mean, when would we expect to know whether this is really going into effect in January of 22, or should we sort of anticipate that it won't be until 2023, for example? Is there any way for the licensees to have any insight into how quickly the process might move along?
Well, part of that is actually going to depend on some of these governor's extensions that are currently in effect, that gives all agencies additional time on the rulemaking process, which would include any Department of Finance review as well as OAL's review. And so at this point, because we're waiting to see, in the next couple of weeks, how those orders might be changing, given the lessening of the emergency, I don't have a specific deadline, but we would know at the point that agency approves it and it goes to OAL, we will have a much better idea of what the timelines will be, because that will be as of the date it's submitted to OAL, and we can definitely reassess at that moment. Is there a specific amount of time that you want the licensees to have before regulation goes into effect, for instance?
No, I don't have a specific time. So I'm the CEO at the California Psychological Association, and we are just beginning to get questions from licensees regarding, I mean, this has been years in the making, and so we're getting questions because they know, our members know, that the stated implementation date is January 2022. So those people who have license renewals coming up in 2022, for example, first part of 2022, are beginning to, want to know, should I plan on using some of these new activities for my CE credit? Now, I have been in touch with Antoinette, and both of us have agreed that right now, what we're telling our members is that we're suggesting they go on the basis of the current regulations in collecting their CE credits, because we don't know. But it just is this, it's sort of a gray area, and it's so ambiguous about when this might actually be implemented. That's the reason I'm asking the question. I don't have any particular timelines, and I understand what the process is. And I guess the answer, what I'm hearing is anyway, is that we really just don't know, because we don't know how long it's going to be before it goes to OAL. Am I correct?
Yes, it could be as soon as August.
Mm-hmm.
But the externalities of how long it's taking agency to review things or how long it's taking Department of Finance to review things are still kind of in flux at the moment.
Mm-hmm. Okay. Well, that's fair enough. I mean, we just kind of like to check and see, and we all know there's going to be a transition year as well. We all understand what's built into guidelines. So thank you for that update from both of you. Appreciate it.
Thank you.
All right, this is the moderator. I see no further requests for public comment. Madam Chair, would you like me to close the Q&A panel?
No, I just have a question with Dr. Jolinda Crow. Is there if you could, how do I want to ask this? Could you characterize like a member of your organization that might be affected in this interim period? So we have a regulation in place and we are waiting for a date of the new one. Like who is it that might be affected and in what way?
Sure. I received a question just recently from someone whose license will be renewable in June of 2022, right? And so he was thinking of setting up a consultation group of the type that will be allowed under the new regulations. So his question was, if I set it up now, or should I just wait? But if I set it up now and begin to accrue some credits, will I be able to count those credits once the new regulations go into effect? If they go into effect in January and I renew my license in June. So I think it's the crossover is what is making people question this. For example, someone was one of our local chapters asked me, as they're doing recruitment for people to serve on the boards of their chapters, they said, well, can we say in our recruitment that if you serve on the board of our local psychological association, you will be able to use that as part of your CE requirement? So it's those kinds of questions. And, you know, I think we don't know. I mean, I have just erred on the side of being very cautious in saying anything about that. I told the chapter, I said, I wouldn't say that in your recruitment because we don't know. Maybe it won't go into effect until 2023. And then, you know, you don't want to misstate something. So it's those kinds of things, I think, that people are asking about. They're trying to plan ahead and they're seeing that some new opportunities would be opened up in terms of earning their CE credit. And they're just beginning to wonder, well, how soon can I begin to utilize those kinds of credits?
Are these, just generally speaking, are the practitioners that are reaching out to you, have their opportunities to access CE units, has that been affected? I mean, obviously by the pandemic or other things, that these new opportunities would be very important to them at that time of renewal?
I don't think it's related to the pandemic. In fact, I think to an earlier comment from Dr. Phillips, I really think that many people have been able to earn their CE credits. Our organization has offered multiple CE credits, some of them at no cost to our members through webinars. And we have not heard from very many people that have said they've had a hard time getting their credits. I think it's more that people are beginning to, they're looking forward to it and beginning to look at it as some of us hoped they would, and that is as an expansion of the kinds of things that they can participate in and utilize some of those activities for their CE credits. And so they're just trying to sort of plan ahead. Some with activities that they're already doing, like consultation groups. And other people are thinking proactively down the road and saying, well, I'm, you know, thinking of setting up a consultation group, or maybe I would volunteer to serve in a leadership role in a psychological organization, or I might be teaching a class. Am I going to be able to use that? I think it's more just trying to think forward and plan.
Okay, thank you for that.
Sure.
It
Thank
just
you for the questions.
it just helps to humanize, right?
Right.
How
I think it's all
how
positive. I
things
think
are
it's all
affected.
positive for
Mhm.
sure. It's positive. It's just that it's ambiguous at this time. And
Mhm.
so I think we're all probably going to have to live with a little more ambiguity than we would like when it comes to the regulations.
Okay. Yeah.
I wanted
Thank
to
you.
follow up on this discussion.
Go ahead.
Yeah, I think uncertainty creates anxiety among the licensees. And you can see it flare up every once in a while on various listservs. People just not sure what's going on. And because of the way that the regulatory process works, we can't make a clear communication to them. For instance, when's the implementation date? They've been waiting.
Right.
We've been talking about continuing professional development for the entire time I've been on the board. And this is now my third term because I did the full first term. And it's perplexing as a board member and also as a licensee. The process is so labyrinthian and so glacial that as a board member, when other licensees ask me, well, when is this going to happen? It's like, I don't know. You feel kind of foolish. I'm going to guess, I'm just going to take a wild guess, and nobody can rely on this guess. It's not going to start at the beginning of 2022. And in fact, I think at this point, gotten so late in the year, I'm not sure it should. Should probably be put across to 2023. But I sure as heck hope that it is in place by the time my third term's up, which is 2024, because it's very frustrating. And I understand that everybody has a role to play in this process. I do think there's some additional steps that have been added to the regulatory process, like a regulatory approval process, that frankly I find completely unnecessary and become just another roadblock to moving forward. But I certainly hope we have some kind of answer by the end of this year as to when the implementation date's going to be. But my wishes don't get us very far down the road. So I guess I'm expressing frustration as a board member and a licensee with the uncertainty that licensees have been asked to live with.
I think you have hit the nail on the head. And, I'm in my 17th year in my role. And so I've been to a lot of board of psychology meetings. And we've been talking about these regulations for a very, very, very long time. And I think you're right. The Byzantine nature of the way that it has to happen, like you have these regs and they're approved. And then even after they're approved, it seems like there's a whole additional review that is put on top of the other review. It takes forever. And I think you've hit the nail on the head. It's very hard to explain to licensees why it takes so long, how the regulatory process works. And so, the sooner we can know, the better, but it just seems like it's built into the process. But I love your term, glacial. It's glacial in nature.
Thank you for your comment. Is there any other public comment?
Ms. Cervantes, I just want to make a quick comment on the regulations. I think, anticipated a little bit of a crossover or some possible anxiety between our current model and the next model. So the one thing we did do in the language was we built in a straddle year where someone could, at the effective date of the regulation, choose either the traditional CE or the new CPD model. So our foresight apparently was pretty good on that, at least, insofar as we would allow either model once the regulatory package may take effect. So I just want to point that out real quick as we close that discussion.
Thank you, Ms. Sorick. I was going to ask you about that. Because we're still in the public comment, I was going to close this part and then come back to see if there was any other committee or staff. But since we're here, Mr. Glassbeagle, did you have an additional comment?
I was just, Ms. Sork and I were on the exact same page there, talking about the straddle year. And then just to add on, that is section, sorry, I left the language, 1397.61M as in Mary. That is where that straddle language lives. So if anybody takes a look at the modified text, that is, it is under section 1397.61M. Now, keep in mind the way we wrote the package, there are basically 2 of every section because we have one section ending and then the next one follows after, and that would be the new section. So it would be 1397.61M like Mary for the section, and the one that is fully underlined. That is it. Thank you.
Okay. I see no other public comment.
That is correct. This is the moderator. Would you like me to close the Q&A panel?
Yes, please.
Okay, it's closed.
Thank you, everyone, for the robust discussion. It's important that that we use our time to talk about these things and consider all the ways that people are affected by all of these policies that we discuss here. Then it's obviously the most important part of our work together. So thank you, everyone, for that. So I see no other comments for item 9. We'll move to item 10. And item 10 is recommendations for agenda items for future board meetings. I just want to take a moment to read the note here. The committee may not discuss or take action on any matter raised during this public comment section except to decide whether to place the matter on the agenda for a future meeting. Is there any comments for item number 10 from members of the committee? Seeing none, could we open public comment?
Thank you, Madam Chair. I will open up the Q&A panel, and if any member of the public would like to comment on this agenda item, please type "I would like to make a comment" using the field in the lower right-hand corner of your screen and submit it to all panelists. We are displaying instructions. This is the moderator. I see no request for public comment. Madam Chair, would you like me to close the Q&A panel?
Yes, please.
Okay, it's closed.
So seeing no further comment, can we have a motion to adjourn our meeting?
So moved.
I don't think you need a second, but I'm in support of it.
I think there's a unanimous support to adjourn a Thank you very much, everyone. It's been just a lot of work that has gone into our deliberation for today. Although our deliberation for today was short, there is years of discussions and ideations and research that has gone into those, into us being able to have this discussion today. So just thank you, everyone. We're adjourned.
Thank you.